So thanks for joining me today. I have Meenakshi Budhraja, a fellow physician here, and she's going to share with us her story and kind of give us some motivation and some tips. And so, thanks for your time and for sharing your story. And if you could just start by telling us a little bit about yourself and what you currently do.
Sure. I've been in private practice at the same office location for about, 25 years, in not such a nice part of town. I take care of the 49%. Um, and I've been very happy and fulfilled. And about 4 years ago, I decided that really my time would be better spent if I could help people prevent illness rather than treat illness as it happens. I live in a town where most people are working poor. They have two jobs. Sometimes they don't have insurances. They are, um, an average patient of mine has two children, and both parents work full time, sometimes extra jobs to just get the ends to meet. And so I see a lot of problems in from a social sort of a standpoint. And I thought that for me to make things better would be to engage more in prevention as far as food is concerned, and also have a culinary school, the Pulaski Technical Culinary School, within a 2 mile radius from my office. So that's how I got connected with them.
So how did you find the culinary world? Obviously, is quite different than the traditional physician role. How did you get into that, or how did you learn those skills, or how did you get there essentially?
Well, I'm a home cook, and I'm like to call myself a almost vegetarian. And forever, I would not even share what I ate with my patients. Like I would take a dietary history, but I wouldn't tell them what I ate because I was like they would freak out. Like if I tell them that I didn't eat meat. So, but that all changed like 3 or 4 years ago, and I paid a visit to the culinary school, and I hung out with the students, and I asked them, "What are you going to do when you graduate?" And so out of a class of maybe 20, like 10 of them wanted to become pastry chefs. And look at our obesity rates. I mean, we need
Right.
pastry chefs in Arkansas like we need a hole in the head. So, so I started showing up there, and I talked to the instructors and the dean of the of the school, and I thought that we could sort of change the culture in the culinary school because, as you know, culinary schools are all based on French techniques, and it's all about meat. It's all about pastries.
Sure.
And so I think they got tired of me showing up, so they said, "Why don't you come teach here?" So they hired me as adjunct faculty, which meant that I would have to finish my own practice and then go teach over there. So that was a challenge. So on Wednesdays, I finish my clinic at 5, and I'm there at 5:30 teaching a class on healthy foods, which, by the way, has a sort of a negative connotation in a culinary school. People think that we advocate just eating broccoli and carrots.
Sure.
And so this is new for me, and I don't, I'm not still settled in as to what my ultimate goal is going to be. But I will tell you this, that there was a chef convention a couple months ago, and they asked me to be one of the speakers. So that's
Exciting.
a challenging experience to
So,
talk to chefs about healthy food and food systems.
so do you find that there's some resistance as you're sort of injecting your own physician flavor into the knowledge and teaching and education of the culinary chefs?
It's been fascinating because I also go for the core curriculum series of lectures at the university in the GI department. So we end up actually reviewing the same papers. For example, the New England Journal article that recently came out about Mediterranean diet and olive oil and vegan microbiome. We review the same papers in the GI division at the university, and the same. Oh,
Oh, yep. I think you just bumped the hold button. There we go. Okay.
So yeah, the chefs have been extremely receptive to just the medical aspects of the evidence that is now accumulating. So I think there's a perfect storm coming with open source information, with the same medical information being available to chefs. And the chefs are the only ones that actually have hands-on experience with food. They touch food, they see food, they cut food, and they cook food, as opposed to dietitians. Which I'm surprised you haven't asked me why didn't I work with dietitians.
Tell
So
me.
yeah, and this is the reason, because I just don't feel that the dietitians kind of get it. Does that answer your question?
Yeah, I agree with you. It seems that the people who are trained in traditional dietetics are really kind of sort of in cement as far as what they view the food pyramid and the structure to be. Like, I'm not a vegetarian, but we eat almost no meat in our house. And my children, when we go out to eat, if they have to eat a hamburger or something, they get somewhat ill from eating it. And so I think that there's a lot of room and a lot of growth.
Yes, absolutely. I think the dietitian culture is very hospital based. And
Yes,
I can't even think the last time a dietitian actually helped. They all end up substituting Boost for Glucerna for whatever. They're all very processed food based.
correct.
The dietitians that I know they don't even know how to cook. So, like, I'm a big proponent of bringing culinary skills to physicians and trying to bridge the gap between chefs and physicians.
Excellent. So a lot of physicians that I talk to that maybe are interested in doing something to still help patients, but maybe a different twist than just the traditional medical practice. But they all say, I don't have enough time. I don't know how to approach this. I'm so wrapped up in my practice. What advice would you give someone who really kind of wants to do something else, but is sort of using the busyness as an excuse to not pursue their passion?
Well, I'm sure you're well aware of the numbers, that how many physicians are burnt out, close to half of us. And that's not surprising at all. And the thing is that we are no longer in control of our lives. We're being pulled in different directions. And so I think what I would recommend is to take a step back, take some time off. Take some scheduled time off when you're doing nothing, like take a Tuesday afternoon off or a Monday morning off, and just clear your schedule and clear your brain. And then start to think about what really excites you. And after you've decided that, or you may not even know that, because you've been on this treadmill for so long that you've forgotten what your interests are. So you might want to just take time off and just get on social media. I highly recommend Twitter, and follow different people and see what excites you. And then connect with people who have done the same thing. For example, you might want to combine finance and medicine. You might want to combine cooking and medicine, like I've done. Or you might want to combine social policy. Or you might want to combine politics and medicine, and then follow people who have done so, and then talk to them. People will talk to you on Twitter, and they mentor you. People are very generous with their time. And it may take you 6 months, it may take you a year, but you will transition and develop. And I think this is a recipe for avoiding burnout and really reinventing your life.
Yeah, I agree with you. It's excellent. I love your Twitter handle, GastroMom. Very cool.
Thank you.
And that's how we connected. And
That just covered it completely explains who I am.
yes. So it's a little bit unique that you're in a solo practice, and obviously healthcare reform is changing rapidly. Large groups are just swallowing up as much doctors and hospitals as they can. What sort of impact do you think this is going to have on you in the next 1 to 3 years?
Probably none. I really love my practice. I enjoy my practice. And I'm a bit unconventional, because I've been in this community for so long that I friend my patients on Twitter, and my patients become my friends, and my friends become my patients. And that is the way it should be in a small to mid-sized community. So I don't have a problem with that. And since I don't work for anyone, I don't have to answer to anyone. So it's really good to be in private practice at this time. And with the advent of electronic medical records, it's actually become a lot easier to be in solo private practice because you're so much more in control of your practice than earlier. And the other thing I've done with myself is I have quit going to hospitals, so I
Okay.
don't do any inpatient work. And I'm lucky because we have a good relationship in our community with the university physicians, with physicians in private practice, and so I'm able to do that at this point. So that means I'm only doing outpatient medicine, which is, as you know, I mean, much better control over your life
Right.
than to be doing inpatient as well as outpatient medicine.
Absolutely. So where do you see yourself in 3 years? Do you see yourself still doing what you're doing right now, or do you see yourself more of a blend of the culinary arts, or where do you see yourself?
In 3 years, I will be doing part time practice, devoting a little bit more time to culinary arts. And also, I will be probably getting a bit more active in the political arena.
Okay.
I would want to serve on some of the boards that I care passionately about, be in touch with the governor's office and see how I can help be more of a part of governance of my community.
Okay. This is sort of a generic question that I ask everybody. If you could remove two barriers, that being time and money, if those were not a factor in any decision, what would you do tomorrow? What would you do? What would be your ultimate dream to do every day?
My ultimate dream would be to have a teaching kitchen right here in downtown Little Rock, and to have workshops every day and bring patients, farmers, chefs, and physicians and medical students together to cook and talk about food and how we can change our food system as well as our healthcare system, because I see a direct connection between our food choices and our health outcomes.
Absolutely, that sounds exciting. As a medical student, I think they offered us an optional nutrition course, and about half of us signed up for it, and I think probably less than 1% probably finished it. I made it like 2 days. It was so painful, and taught by a dietitian, which was really helpful for what I wanted out of the course
Yeah.
myself. So I think physicians are probably somewhat ignorant and how important nutrition is. They tell their patients eat healthy, cut down the pop and the fat, and you'll lose weight and improve your health. But that's really not quite the level of advice that most
There's
patients need to hear.
so many misconceptions about food and nutrition in the medical world that I think really need to be challenged.
I agree. I agree. You touched on an important thing about the physician's burnout. I mean, depending on the specialty, the numbers certainly are quite scary, and I think the general public probably doesn't even know how bad it is on the inside. But what do you suggest? You mentioned taking some time off. A lot of people I talk to say that they feel like they're dead inside and they can't figure out a passion or how to find their passion. Do you have any advice about how people could go about looking inside themselves to try and rediscover something?
Yeah, I think you should really look back to when you were in high school and in college and remember, try to reconstruct those days and see what kind of turned you on and got you going at that time. And then connect it to what your family's passions are. Like, for me, it has turned out to be cooking and food. And as I mentioned earlier, for other my some of my colleagues are really into like stocks and investments and stuff. So that is a great place where you can actually combine two professions.
Hmm.
Healthcare policy is something I think we are completely underrepresented in. And get to know your political people that represent you, because politics is everything, and at some point in your life, you will always be involved in some kind of a political decision. And I think it's really incumbent upon us to educate the politicians about science and about healthcare policies because they affect us directly. So I think politics is something that we really need to be represented in better than we are right now.
Absolutely, absolutely. So you're busy. You have a solo practice. You teach. Your husband's a physician. You're very busy. How do you? What sort of time management tips can you share to kind of coordinate all that busy schedule?
Well, I think of myself as a CEO of my kitchen. So I delegate a lot of responsibilities. Like, for example, my husband is in charge of going to the farmer's market, so he's the hunter-gatherer.
Okay.
And then once a week or twice a week, we have family dinner together where my, kids come over and my son and daughter-in-law come over. And then my life, other than my office, really revolves around my kitchen.
Okay.
So everything is around me, and I cook every day. We don't hardly ever go out to eat. And I know that's bad, but I guess, none of my family doesn't seem to mind, so we're okay with that.
Why do you say it's bad?
Because I miss people talking to me. They say, so have you tried this new restaurant? And have you tried this particular
Sure.
dish somewhere? And when we do end up going out, there is no vegetarian choices in my city. And
Right.
that's something I hope to change by talking to the chefs.
Excellent.
So,
Just one last question for you. So, what activity or type of project gives you the most joy, the most passion, and how could a busy physician start to work on their true passion?
we didn't talk about exercise and wellness, and I think that really should factor into every physician's schedule for avoiding burnout. But more than that, there's something that I've been working on with a couple of occupational therapists, uh, specific to gastroenterologists, um, which is avoiding injury.
Mm-hmm.
40% of gastroenterologists develop chronic injuries related to using endoscopes.
Really?
Right. And people don't like to talk about it because it's like mostly guys and they don't want to be perceived as being weak or
Mm-hmm.
injured or whatever. So, but the rates of chronic injury amongst cardiologists and gastroenterologists are fairly high. Injuries to the shoulder, elbow, back. And so I think this type of injury prevention needs to be built into training programs. So this is something that's been on the back burner for me, but I'm planning to work on that a little bit more as I get more time off.
Interesting. I guess I would have never thought that would have been, the danger, obviously.
Yeah, that's not part of our, how to cope with. You have to wear heavy lead aprons for ERCPs for, an hour, 2 hours at a time.
Sure.
Cardiologists do that too.
Mm-hmm.
And it really puts a lot of strain on your back muscles. So there's like a yoga for
I love it.
that you're working on.
Excellent. All right. Well, where can people find you? How can they connect with you? How can they see what you're up to and where you're headed?
Well, I don't have a blog. I just don't know how to blog, but I'm sure somebody was going to tell me that. Anything that I can do on my iPhone, this is the only thing I end up doing because I'm mobile most of the day.
Sure.
But yes, you can find me on Twitter. Twitter is where I hang out.
Okay, so Gastromom on Twitter.
Gastromom on Twitter.
Excellent. Well, thank you so much for your time, and I'm looking forward to seeing what great things you come up with in the future.
Well, thank you so much. It was lovely talking to you.
Yeah. Let me just get my desktop set up here. Thanks for doing this.
Oh, you're welcome. First, tell me about yourself.
Absolutely. So about 4 years ago, I met a group of entrepreneurial physicians who were, still practicing medicine, but kind of looking to do something a little different than just, go to the office every day and see patients as fast as I could. And so I sort of transitioned out of clinical medicine, at least full-time, a couple years ago. And I started this project just to kind of connect with other physicians who are doing things more in line with their passion and not necessarily involving a stethoscope or an endoscope, and just kind of sharing the journey to help others who are looking to find something, a little different to do along the way.
That's fabulous. So you're not working at all now?
No, I still am. I work about 1 day a week clinically, and I'm an emergency physician, so I do some ER work, and then I do some clinic work as well. So
it's easy to do that if you're an ER physician, and I'm finding it so difficult to back off of clinical duties, but I'm still finding time to do this. So I'm really enjoying myself. And same thing with me. Like 4 years ago, I decided that, things could be so much better if we prevented illness rather than after the fact, doing procedures on patients and medical interventions that they might not even need.
Yeah, it seems like we apply a lot of band-aids to problems that are already so far out of the gate. And
Right, that's exactly it. So is your wife a physician too?
she's a dentist.
Oh, good. Okay.
And so
I'm
she,
married to an endocrinologist,
okay,
and we share office together.
okay,
And my son is a third-year GI fellow.
okay, excellent.
So yeah. So and my daughter is a tree hugger. So I've got a variety of point of views.
No problem. Well, here's what I'd like to do. I have just, probably about eight questions or so I wanted to take you through, and
Sure.
just let you introduce yourself and where you're at. And then at the end, I'd like if you would be comfortable just to share how people can connect with you or see what you're up to in terms of your culinary work. And my goal of this is just to help other physicians who are maybe looking to, pursue their passion, to see that there's other people out there that are doing it successfully, and kind of help them on their journey as well. If that sounds all right to you.
Let's do it.
Okay, so thanks for joining me today. I have Dr. Meenakshi Budhraja. Did I say that right? You
No,
say it.
not even. Okay, let's start this again. It's Meenakshi.
Okay, Meenakshi
It's Meenakshi Budhraja.
Budhraja.
Budhraja. Uh-huh.
Okay.